modern identity strategies for today's healthcare IT. And our event partner Okta is going to be driving this discussion. We have Mark Smith, the customer identity and access management specialist over at Okta, actually driving this discussion. So, Mark, please come and take it away.
Great. Thanks everyone for joining. My name's Mark Smith, and I'm a sales engineer with Okta. I'm also a customer identity specialist, and I'm based in Brisbane. To start with, look, just a quick intro to Okta. Okta's mission is identity, and to enable any customer and any company to use any technology, including the healthcare industry. I'll be focusing on building the consumer experience without sacrificing security today. So really sort of focused on that customer-patient identity. So let me get started. Okay, so start with some statistics on portals and that customer-patient interaction. So portals are, pretty big these days. Everyone's got them. Most have many of them, but 1/3 of them are only really productive for the actual users themselves. And patients only, have integrated the portal into their lives 1/3 of the time. So that means that 2/3 of the time, patients don't find it that's interactive and that useful, and they don't really come back. And so I'm going to be sort of focusing on ways to improve that, but at the same time, don't sacrifice your security while you're doing that. So some common reasons for the low adoption, complex account creation and access processes, usability, little value added for patients, so that they don't really see a lot of benefit. And overload from multiple providers and services. So, patients often have, a lot of different portals that they need to access. And that's sort of where I sort of start with my next slide, where, a certain patient might need to interact with, urgent care specialists, could be the emergency department or even a virtual doctor, and could be all four eventually. And each one could require the user to interact or log on to some sort of portal. There could be a patient portal, online scheduling type portal. You need to pay your bills. And obviously with a virtual doctor, you're going to have a sort of virtual visit type portal as well. So many logons. So we can see here that, just for one urgent care, as well as the patient portal, they might need to also log on to another portal to pay a bill. And that's sort of on average generally the case as we go across. And you can see here when we add it all up, that one single patient during the interactions with the healthcare provider might need to log on 8 times. And potentially that could be, if they're using 4 different portals, that could be, 4 different passwords. So, we've got a lot of potential there for an issue. Obviously, the passwords can be a problem. Many users use the same password. Actually, Gartner did a report on this 2 years ago, and apparently 37% of respondents use the same password across multiple websites. And I think, we're all probably aware of that and probably have done it ourselves. And 43% of their online accounts rely on the same password or variations of the same password on average. So, the issue is that, if one site becomes compromised and the credentials get breached, then, the hackers can then use that across all your sites. That's this whole, problem is getting more complex. The reason being is that we have to integrate now with more applications and across more devices. No, not just the desktop. We've got mobile devices, laptops and iPads and all that sort of thing. And obviously more locations. So, basically anywhere there's an internet connection, patients want to or need to access their portal. So looking at an IBM breach report, which was out in 2020. This is a global report, and globally, the cost of a data breach was 5.4 million. This is in AU dollars. In Australia, a little bit less, probably because the number of users is probably smaller in Australia, but it's still 3 million, which is quite a substantial amount. There's a lot of reasons made up of a breach and the cost of a breach. It could be the cost of mitigating, the cost of finding the actual breach, the cost of lost customers, and the cost of implementing new technologies to fix that breach. And so it's a whole range of things that make up that total. Unfortunately, the healthcare industry seems to be the top of that stack as far as breaches go. Why? Because healthcare industry has a lot of information that a lot of attackers want, personal identifiable information, and they could be disgruntled employees, could be organised crime, could be nation states. There's a lot of different reasons why hackers would want to try and get hold of that information. On average, the loss per record or per user record is $210. That doesn't sound much for one record, but when you add it up over thousands or even hundreds of thousands of records, it quickly adds up. It can be quite expensive eventually. The stat that sort of surprised me, still does, is that it takes 329 days on average to actually mitigate a breach. There's quite a bit of time to, like I said, identify the breach. Identification can be, how many user records have been compromised, and if they've been compromised, what data or what information has been compromised, and then how to contain it. How do we stop that? How do we plug the hole? What do we need to do? So it could be almost 12 months that it takes to mitigate a breach. Anyway, let's move on to more of a local type report. This is the actual the Australian Government's Notified Breaches report from 2020, or the first half of 2020. And so you can see here that healthcare service providers unfortunately are top of the list. So there really is a big issue in the healthcare industry in regard to this type of breach. And another stat to go with this is that 25% of patients don't access their records online because of security or privacy concerns. So, the patients and users and consumers out there are now, becoming more aware of these breaches, and it's not really giving them any insurance. So all of this, is probably information that everyone already had some sort of perspective or some knowledge of. But it's also a good way to start to lead into how do we fix all of this, and how do we mitigate these breaches and the cost involved. So let me get on to what Okta can do to help and how we can tackle it. And so I want to look at the concept of a digital front door. I think that with the issue of having multiple logons and multiple ways that a hacker can get hold of an identity or some credentials, if we have a single front door which actually enables a user to sign on once with one set of credentials, may not even be a password, maybe another factor, and once they've been authenticated securely, then we can allow them access to whatever they need access to. So what this opens up is enables up a care ecosystem where we can actually leverage that identity, that authentication, authorization across the whole ecosystem. So you've got multiple applications, multiple portals that the user needs to access. We can leverage that single identity across the whole stack. Optimize consumer productivity. So obviously only having to log in once, the people are more productive, much easier for the actual end user. obviously enhanced security, where logging once, there's less chance that those credentials are going to be hacked. And I'm going to go into a bit more detail on how we can actually secure that with Okta. And integrate healthcare and lifestyle, so improve the patient's engagement through transformational digital experiences. That just sort of fits in nicely with the single gateway for a user to access all of their applications. As an example, Okta has worked with a number of healthcare providers. This is a good one because they're extremely large. They came from very disparate background, where they had a number of different systems, mostly on-premise legacy type stuff, all siloed. Users, patients had multiple logons in multiple repositories. It's a very good use case. And you can find out more about Dignity Health on Okta's website or Dignity Health themselves. Just to give you a bit of a scale about how big they are, it's 60,000 employees, 10,000 physicians, literally millions of patients. If an organisation this large can actually achieve a single logon for a patient and seamless user experience across all of their portals, their website, and whatever the patient needs to access. If someone organisation this large can do it, I think that anyone can do it. So where do you start? Obviously, you just want to start slowly and work up. So we've sort of divided that into 3 levels, and we can represent them as crawl, walk, and run. So it's sort of 3 steps to get there. And as I go through each step, it's probably going to make a bit more sense about how we can actually achieve this. So where do we want to get to? So this is the sort of the end state where we've got these multiple portals across the ecosystem, but we want to have a single gateway for a user to get into these systems, a single identity, a single set of credentials, and maybe without a password. And then once we've done that, we've got a lot of benefits that can flow from that. So we've got the insight of data across health systems. You can actually highly personalize the experience for your customers. And they're going to really uptake and drive behaviours that are going to stick to your portals and your website. Enhancements is that obviously more secure and more customer-centric products and services. So that's where we want to get to. What part of Okta can we use to do that? So Okta has a lot of different parts to the Okta service. Single sign-on, that's obviously one of the core ones, where user signs on once through Okta. They can access all their applications, all of their portals, anything they need to access without having to sign on again. Obviously a core part of Okta. Adaptive multi-factor authentication is another part where, as part of the authentication process, we can actually enforce a second factor or multiple factors, or even step-up authentication where you want to access something a bit more secure. For example, at the payment portal, at that point, you might want to step up and enforce a second factor again at that point. Adaptive, that's adaptive multi-factor authentication. API access management, so that's another key part, especially to do with customer identity. That is the ability to actually secure all the API calls that your website or your portal needs to make in the back end. So obviously the portal needs to go and retrieve information from maybe internal services and systems. Those calls need to be secured, and the way we do that is with the API access management. Under the covers, that is the OAuth and token-based authentication. User management, obviously another key part, is the ability to actually have a central view of a user in Okta. where Okta's universal directory, we can actually link multiple external accounts to the one single account in Okta, and we can actually do things like attribute level mastering, where different systems can be in charge of updating and maintaining certain subset of attributes on the user's profile. So that means that Okta can actually be the complete 360-degree view of the user and all their information. And so there's only one location you need to go to pull that information back. And so that's one of the huge benefits of Okta's user management. Finally, lifecycle management is the ability for Okta to go and create accounts out in applications or portals or whatever it is as the users have been assigned access. And so this is Okta's integration with internal or cloud-based systems to provision user access and user accounts. And so that can be completely automated with Okta's lifecycle management. Once the user has been assigned access by rules in Okta, Okta can go out and actually provision accounts and also work in reverse. So if that user changes roles or leaves or whatever it is, we can go and deactivate those external accounts and pull that information back and remove all of that access. And that all comes under the lifecycle management banner. So that's some of the parts of Okta that can be used to actually achieve some of what I'm talking about. So first step is obviously to be able to crawl, and so the way that we're going to achieve that is starting here. This is the as-is state in a lot of early stages of this transition, where one person, a patient, customer, whoever it is, needs to log on to many applications, many portals. Each one is totally disparate to the other, has their own identity store, and so you've got multiple logons and multiple chances of those credentials being leaked. So the first step is to put Okta in the mix. So once we put Okta in the mix, then Okta is going to manage those external accounts on behalf of that user. And what the result is that the user now only needs to authenticate once against Okta. And then once they've authenticated against Okta, they can then be trusted in all the applications. And that's sort of what we get with the single sign-on. Sign on once through Okta, and then we can go and sign those users into those applications or portals or whatever they are, depending on their requirements. The way that Okta does that is we adhere to all the standards. So we've got SAML, we've got OpenID Connect, we've also got pure OAuth, where we can do token-based authentication as well. So there's many ways that we can integrate and sign users into their applications and portals. So that's I guess the very first step is to try and get a single set of credentials that user can log in with. Then we can overlay additional features on top of that, and that's the next step. So it's a walk. So first thing is that as a customer external user, I might want to bring my own identity. I might want to use my own identity rather than having to go and create another set of credentials. Maybe I just want to log in with my Facebook account or Google or whatever it is, my social account. So users can actually go and log in with that. And then Okta can actually accept that authentication and trust that user's been authenticated. Can potentially then overlay additional multi-factor authentication on top of that. But at least the user doesn't have to actually create a secondary set of credentials. Then on top of that is the multi-factor authentication. So I think everyone probably would know, obviously what MFA is. This is just a basic sort of step-through scenario where obviously you authenticate with your username and password, and then you can be sent a code or some other form of second factor. But Okta goes a lot further than what is depicted in this diagram. We also provide the ability to actually do password-less authentication. So what that means is that a user can enter in their username, not have to worry about entering a password, but can use another factor other than a password. For example, they might be able to use some biometrics, or in this case, it's SMS. But there's different levels of assurance that come with certain factors. So Okta actually has quite a large number of factors that we support. And as I said, password-less authentication, which is much more user-friendly, actually more secure. Users don't have to be entering in their password, and they're using a factor that they actually own. So what types of factors does Okta support? Depends on the assurance that you're looking for. Obviously, password security questions are the least preferred because of their level of assurance. But as we go through, these are some of the factors that Okta support, and we see as we go across, we're getting a higher level of assurance. Depending on what type of portal the user is logging into, with Okta, you might want to then give them either a less assurance type of a factor, or a factor with a greater level of assurance if it's more of a secure type payment type portal. And with Okta, we can actually provide different factors at different times, depending on users' requirements. So yeah, this is some of the factors that Okta support. We have about a dozen of them pre-integrated with Okta. We also have a generic type interface where we can actually integrate many more factors. Another one here, which is not presented, that is widely used within healthcare industries, is swipe cards, especially obviously for not so much for customers, but for staff and things like that. So anyway, let me move on. So one more thing with the multi-factor authentication is the ability to take in some sort of context. So with Okta, we can take in lots of different context about when and where we're going to enforce a second factor. Basic example is the user's location. So, if the user is located maybe on premise in the hospital, maybe we let them in a bit easier than if they're located, outside the hospital or outside the country. So we can actually take into account things like proxy detection, IP address, also things about the device. Obviously, managed devices only really come into play for employees, not for external customers. As I said, geographic location. Putting all these factors, all these contexts together, we can then either allow access, we could deny access completely, we could prompt for a second factor, or we could re-prompt for a second factor if that context changes. And as I said, we can also do password-less authentication as well. So in summary, there's a lot that Okta can provide with multi-factor authentication. So now what we've got here is we've taken on those additional features from our first step. We've overlaid them on what we've done already. First step was to integrate Okta into the ecosystem, providing a single set of credentials users can log on with, accessing all their apps. And now we've provided the users with the ability to actually use their social login, and also we're going to overlay multi-factor authentication and even potentially use password-less authentication. Also improving the user experience. They can log in easier, and also improve the security because we're not using passwords in that case. So anyway, that's the first two steps. Now we're looking at the final step. This is where we can actually onboard and integrate more things into that customer experience. And in this case, a CRM system is a perfect example. Obviously Salesforce is one of them. There's many of them out there. But a customer relationship management system can be integrated into the mix. And what this is going to do is provide personal preferences for each user. We're going to have a greater level of satisfaction. We can actually be able to capture more attributes, more information about that user. We can actually use that information for marketing campaigns and that sort of thing. So it's really going to improve that customer experience. So to go with that, the additional information, as I said, additional attributes and the capturing of them. What Okta can do is what we call progressive profiling. And this is another important part of what Okta can do, is that we can actually capture that information at certain points and actually store that in the user's profile in Okta, and as well push that information out to a CRM system or any other system that needs to know about it. So we don't have to force the user when they register for the first time. We don't have to force them to actually submit all the information. We can actually just get the information that we need at that initial touch point. Maybe we just want to capture their email address so we can actually send them some additional information they might be interested in. And as that user experience continues, we can capture more information as we go along, as we need it. So depending on what the user is trying to access, at that point we might need them to actually physically create an account and onboard maybe some additional factors, enroll in some factors that they need to log in with. And then we can sort of capture some additional information. And as we capture that information based on certain conditions, we can then store that information in Okta and push that out to a CRM system. And so what we do is we get to the final state where, as well as the single sign-on, social authentication, multi-factor authentication, we're actually doing progressive profiling, and we're storing that information in something like Salesforce or any other CRM system. We pretty much integrate with all of them, and that's going to lead to a better user experience as they interact with your healthcare system. So that's sort of the final sort of step, so I think I've run through from the start to finish, sort of very high level of the steps involved to actually change from what potentially can be an issue now with all the disparate systems, to give you an idea of how Okta can actually help and amalgamate all of that underneath a single gateway, a single entry point for a user to access all of their applications. So that's the end of the slides. So I wanted to finish a little bit earlier on the slides so I can actually take some questions. So please feel free to put some of those questions into the chat. That's my details on the screen, Okta's address on the website. But yeah, I'm more than happy to answer any of those questions now or later if need be. Great. I hope that was of benefit and of some interest, and I hope you learned something about Okta and how Okta can help you.
Thank you for that wonderful presentation, Mark. What you did was to also show us some tangible ways to do it rather than just giving us an overarching understanding of what's possible, right? So it was very meaty, and I'm sure people appreciated the ability to run through that. And I do have a few questions that have come through from the audience as well, which I'd like to take us through. First one is from Paul Hankin. He's wondering, what if Okta gets hacked? Aren't we just creating a single point of failure then? That's his question.
Yeah, okay. Look, that's a common question, and I can certainly understand your concerns. So there's probably two parts to that question. Is firstly, Okta's uptime and highly available architecture to make sure that the Okta service, being the single gateway for users to access all of our applications, Okta always has to keep running and always has to be there. We provide 99.99% guaranteed uptime, but realistically, Okta is running close to 100%. So the way that we do that is that we run in AWS, and we actually have to have 2 physical data centers across 2 physical geographic locations. Each data center has 3 availability zones in each one, so that's a total of 6. Okta only needs 1 to be running to provide the service. So it really is that kind of highly available architecture at each level, at the DNS level, at the database level. Every level has multiple redundancy points. So we're always up and running, and we publish those stats online. Secondly, hacking and how Okta can prevent that. First thing is that we've got a number of different certifications, and these certifiers have actually gone through due diligence, a number of things to ensure that those sort of things can't happen. We're actually IRAP assessed. We've actually got the SOC 2 Type 2 report, which is available to our customers and prospects under NDA. And that has a lot of detail about, the lengths we go to, and also the fact that it's been verified. And we've got, the ISO standards as well. So there's quite a number of different things that we comply to. But in summary, we actually encrypt each Okta tenant with a different key. And so even if each customer has their own key. So the data is encrypted on disk and in transit. Even if someone was able to capture that data, they couldn't decrypt it. So I suggest that we can provide you a lot of information, a lot of detail, a lot of reports that can maybe put to bed any of your fears in regard to Okta security and what we go to provide that. So I hope that answered the question, or at least went some way to answering that question.
Yeah, for sure. And I encourage people to have a chat as well further about that. And I see here a couple more questions that we can cover actually. There's first one is about how Lauren's asking, can you tell us more about how you can integrate with on-premise?
Yep, that's a pretty good question. So the healthcare industry is notorious for having a lot of on-premise applications, on-premise legacy apps, and I know there's lots of them out there, and it's a big process to obviously change that, and obviously invested millions of dollars into those applications, so it's not an easy thing, both practically and financially. So what Okta does is we actually have a what we call the Okta Access Gateway. It actually runs on-premise, normally deployed in the DMZ. And it talks back securely to Okta. So the secure connection between this component on-premise and Okta in the cloud. And internally, that gateway can talk whatever protocol is required to the on-premise applications. And so the end result is that those on-premise applications can appear to the customer, to the employee, just like any cloud application, and they'll be accessing it exactly the same way. They won't have, the user experience won't be any different. So the Access Gateway is designed to do exactly that.
There's one more question from Lauren here in terms of the enhanced, I think it ties into the same direction really. What enhancements are required for legacy applications to support zero trust as well? So moving into a more secure environment.
Yep. So that sort of goes with that a little bit. So we're talking about the ability to actually onboard those apps, but as far as zero trust is concerned, so zero trust is basically it's an architecture as opposed to a physical feature. We don't just enable zero trust. So zero trust is coming from the angle that the user authenticating with us through Okta, they're starting at a 0 point, and how do we go and trust them? What do we need to do to trust them? And Okta's adaptive multi-factor authentication is the primary tool to do that. As I said before, there's multiple different factors, but also context is taken into account. And so context can be one way to assist in getting that trust. So, for example, is the user coming from a location they've come from before? If they are, there's a little bit more trust going to be given to them. If they're not, then it's less trust. If the user coming from a device we've seen before, if they are, there's a bit more trust. If they're not, then it's obviously going less trust. And that's the same for each level of context. And so we can know a lot about the user's behavior, and if that changes, then the trust is going to decrease. And if it stays the same, the trust is going to get increased. So as I said, adaptive multi-factor authentication is one of the key parts of Okta that can help provide a zero trust framework. Okay.
No, thank you for that. And I'd like to say one more last question here before we close for the day, unless more questions come in, of course. But I see one here from Sean Gorman, and Sean says, as an infrastructure engineer in the last company that he worked for, he was told to use an account to connect to AWS and Azure, not in Okta, because Okta is not able to work with PowerShell. Is that still the case?
Can you just repeat that again? Sorry, I didn't quite get everything.
I'm happy to go over that again. So there is an infrastructure engineer named Sean Gorman. He's asked us a question saying, in the last company that he was worked with, he was told to use an account to connect to AWS and Azure, but not in Okta, because Okta is not able to work with PowerShell. If that is still the case?
Yeah. Okay, all right. So yeah, look, we have a new part of Okta, and I didn't mention it because it's only had a certain amount of time. It's called Okta Workflows, and so Okta Workflows is a new, as it says, it's a workflow engine, but it's identity-centric engine, and what it can be used for is to call a number of different things. It can actually be configured to actually execute and call some sort of PowerShell, or could be actually any script or any endpoint under certain conditions, and you can create your workflow to do exactly that. So it just depends on the use case. But if you're talking about AWS integration, we actually have pre-integrated applications and integrations with AWS out of the box, where we've done all the integration. It's just a matter of navigating that app in Okta and actually setting it up with your credentials. So probably hopefully one of those two is kind of answered that question. But look, if I haven't, please feel free to contact me, and I'm more than happy to provide some more detail.
Dave, Mark, you're available on LinkedIn, so feel free to reach out or come to us, and we'll be able to connect you with Mark as well if you want to have a further conversation.
Sure.
But I guess that brings us to the end of the Cybersecurity for Healthcare event. And look, ladies and gentlemen, thank you so much for taking the time today to tune in and listen to some wonderful presentations and discussions. It's clear that there is that sense of awareness building in the market around the need to mature some practices, but there is still a lot of work to be done in terms of further education around what's actually possible and what kind of tools and capabilities can actually help you make what seems like a bit of a mammoth of a challenge a little bit easier. So look, thank you so much for tuning in, and please keep the conversation going. And we'll probably be back with the next edition in the not too distant future as well. So keep an eye out for that. Thank you once again, and hope you have a fantastic afternoon ahead.